A breast lift is a procedure where a loose breast that has too much skin is tightened to create a lift and to tighten the skin. For instance, if you look at a breast that's a little bit loose and low with an areola or a pigmented area that's a little bit too big, we can do a breast lift which removes just skin and create a lifted breast with a smaller areola. That's in general what a breast lift is. It takes a breast and tightens the skin, and only the skin, to create an uplifted breast. The trouble with the breast lift is the patient has to accept the incision, which is usually always worth the trade-off to go from here to here. For instance, a patient who typically wants a breast lift is happy with the breast size, or at least feels they may be slightly big, because after you've done a breast lift, even though you've only removed skin, the breast typically looks a little bit smaller. You haven't removed any breast tissue, but taking a looser breast in a larger skin envelope and tightening it into a smaller ball or smaller envelope makes the breast look smaller even though it's not. It's just easier to put a breast that's compacted into a bra than one that's loose. So you typically think your breast is bigger than it really is with loose skin. So that's what a breast lift is. If a patient feels like their breast size is perfect, then after a breast lift they may feel like it's too small, and that's when perhaps an implant is used to at least maintain breast size or perhaps give a little fullness. In addition, any breast lift doesn't give as much fullness in the upper part of the breast, despite the technique, as if you added an implant. The implant allows you to have a little more fullness in the upper part of the breast, but at the expense of adding volume. And of course the additional issue with implants in general. But a breast lift tightens skin and lifts the breast.